Hi, my name's Michelle, and I'm going to be talking to you today about mitral valve prolapse. Mitral valve prolapse is a fairly common disorder that affects one of the four valves of our heart. We have four valves. We have the mitral and tricuspid, and then we have the aortic and the pulmonary. The mitral valve runs on the left side, and it runs between the atria and the ventricles. The goal of the valve is to kind of help with one directional blood flow through the heart and to stop the blood from flowing back into the heart. So the way that the valve works is, it's kind of got like a little flap. They call it leaflets that kind of open to let blood flow out, and then they close back up to keep that blood flowing back in. I'll show you a picture here of the heart. So the mitral valve is going to sit kind of right in here in this area. So this one here looks kind of like a normal valve, and this would be a damaged or leaky valve. So this is where the blood flow is coming back up in, where we don't want that to happen. So kind of an example here, and I've just got kind of two different styles. So if we think about the valve like a little thing, so we got all these little flaps here, the little leaflets. This one has a little leaflet. Those are closed. Those are what we want to see in a normal valve. These are what they would look like if they're open. So we have them here, open valves, open up to let the stuff flow through. And then when we have problems with them, like this one, it won't close up all the way anymore. It's got a little hole in there, and so stuff is leaking through. Same here. So this is like when we have mitral valve prolapse, what happens is over time, it can start to cause problems, where it's like this flap just will not even come down right, and it won't sit right. It'll just kind of stay open a little bit, so that blood starts to go back up. That's called regurgitation. So that is not necessarily a great thing that we want to have to deal with. Our body tends to have to fight harder for our heart to work the way it's supposed to. So how are we going to know that we have something like this? Our symptoms would include things like palpitations, that really kind of fluttery feeling in your chest. It could be chest pain. It could be shortness of breath, particularly when you're exercising. It could be something like loss of consciousness or dizziness even. So it can be a little bit more severe sometimes. Not everybody has symptoms. Sometimes some of the symptoms may just be that we have something like a murmur, a heart murmur, which is just an irregular sound that a doctor may hear when they're listening to your chest. I personally have mitral valve prolapse, and part of how we found out that I had it was through my murmur. I was diagnosed with that when I was like 18 years old or so. So what do we do to treat mitral valve prolapse? Well, if it's not very severe and you're not having any kind of complications, they're not going to really do much for it at all. They're just going to kind of watch it. If you're starting to have symptoms, such as those palpitations, different things like that, they may treat you with something like a beta blocker just to treat the symptoms. No kind of medication is actually going to help to treat the prolapse itself, but they can treat the symptoms of it. Longer term, if it does start to cause more complications or problems, there are some surgical interventions that can be done. Sometimes some of the valves can be repaired. If it can be repaired, then that will be the step that they'll try to take first. But bigger than that, there is also types of replacement valves now. So we have mechanical valves, and we also have some like some biotissue valves and stuff that we're really working on to treat these prolapses. It's just going to really depend on the severity of it and the severity of the symptoms that someone has. Our prognosis is really great actually with treatment, as long as there's some kind of intervention put in. Definitely surgical may be a thing, but the prognosis of it is usually pretty good. Most people with mitral valve prolapse do not end up needing like that kind of extensive treatment, but it is an option for them. So, all right, thank you for listening. Have a great night.